Good day, I'm Dr. Tan Chawi. Today I'll be presenting my poster entitled Sarima Models to Forecast the COVID-19 Outbreak in Malaysia. As we all know, COVID-19 is nothing new to this world, and throughout the past 2 years, we have a lot of mutations, whereby that's why by doing a forecasting, actually it will help the health authorities in control the COVID-19 resurgence of infection. So our paper is to aim to develop a seasonal autoregressive integrated moving average, in short Sarima models, by using appropriate covariates and also by smoothing strategies, both for their dependent and the independent variables, to provide a 28 days of COVID-19 daily cases forecast in Malaysia, which is from the 6th of September to 3rd of October 2021. Here we use a seasonal component is because in our time series data, we notice there's a 7 days of cyclical trend. So by doing this, as a result, these are the result that we have noticed in the table. If without a seasonal component and without smoothing, it is less favorable goodness of fit. Whereas this tree gives a more similar goodness of fit, but actually the forecast, the trajectory that was given by the Sarima models, the first one, which is by using an appropriate covariates and to smoothen both the dependent and the independent variables, give a more similar trajectory as the reported daily cases. So here we would see the training period and the validation period and the forecast that was generated by the Sarima, and with the upper and lower confidence interval. Here the dotted black line is the forecasted cases and the red line is the observed cases, and we have smoothened the observed cases for to put in this chart. And to see the accuracy, we use a deviation index based on this formula. And as we can see here, the nearer to the days that the start of the forecast, the smaller the deviation index is, and the further away from the days of the forecast, then the deviation index tends to widen. But anyhow, majority of the forecasted cases still is within the 25% of deviation index, which is still very acceptable and considered reliable. So in conclusion, I would say that Sarima models that was generated in this paper is closely represent the observed cases, and it can be used to forecast the COVID-19 daily cases in Malaysia. And these are my references, and thank you for listening.